Assalamu alaikum, the communication day. First scenario, you are the doctor in the oncology clinic. Patient name Mr. Ross, 50 years old man. The scenario, Mr. Ross presented with dysphagia, decreased appetite, and weight loss for the last 1 month. On the last meeting, Mr. Ross was told about his diagnosis of esophageal carcinoma and was told that it was likely amenable to curative therapy. However, CT abdomen was still awaited. Today, he is here for discussing the further management plan with regards to cure for his cancer. But on reviewing the tests now, including the new report of his CT abdomen, discovered that his cancer has metastatized to the abdominal lymph nodes and liver, and he is not amenable to curative therapy. Your task is to talk to Mr. Ross about his new diagnosis and further management plan. If you're ready, Dr. Sarah, we can start.
Okay, yes.
Yes, here you go.
Hello. Dr. Auda Karim. I'm one of the doctors covering the Humor clinic today. May I confirm that you are Mr. Ross, 50 years old?
Yes, Doctor, I am.
Yeah, Mr. Ross, we are here to talk regarding your health condition. Is that okay with you?
Yes, Doctor, it's okay.
Okay, just to be in the same page, could you tell me how much you know regarding your health condition?
Yes, Doctor, actually, I had this problem in swallowing, and also I noticed I'm losing weight. I don't want to eat. Then I came here, they did for me some blood test and they did imaging for me. And they told me I have cancer in my food bile. So they told me there is a possibility they can do surgery for me to remove this cancer. Then they requested from me another imaging. They told me then they will discuss with me what will happen.
Sorry for that, Mr. Ross. Yes, thank you for sharing this information with me. I'm sorry for suffering. Actually, the result of scanning that was done for you now with me, and it is not as we hope.
What do you mean, Doctor?
Yes, it reveals that you have this cancer that affecting the food pipe in advanced stage. That means it now is spread out from your food pipe and affected the liver and the bump in your tummy. I'm sorry to tell you that.
Are you sure, Doctor?
Yes, I'm sure, Mr. Ross. I'm sorry for that, Mr. Ross.
So my cancer already spread to another parts of my body?
Yes. Yes, now spirit.
And what does this mean, Doctor?
Yes, I'm sorry for that. I'm sorry to tell you that it means that now in such a stage, your cancer, it could not be curable.
Really?
Sorry, Mr. Ross. I know
But
that
Doctor,
this is hard
yeah, but Doctor, I
news
was
for you.
expecting that it will be treated. They told me there is a possibility for surgery. They can do surgery for me.
Yes, Mr. Ross. Yes, before that, before checking the report of this scanning, yes, suggested that your cancer just affected your food pipe. But now, after reviewing this scanning that was done for your tummy, it reveals that your cancer now is spreading out from your food pipe and it affects the liver and the pump in your tummy. That is why it is difficult to be treated now.
Doctor, I think there is a problem in the test that you have done. Maybe you can repeat the test for me?
I understand your reaction and your worries regarding your condition now. I know this is like hard and shockable news for you today. I'm sorry, I'm quite sure regarding this result and this scanning. It is right and for you.
So you mean, Doctor, there is no treatment for me?
Sorry to tell you that, yes. Now, no treatable. This cancer not treatable now, but just we can keep you in the group of specialists. We should include the cancer doctor and the specialized nurse, which you called Macmillan nurse. And also, we need to put you in the care, which you called palliative care. Have you ever heard about it before?
No, doctor.
Yeah. This is a palliative care. It is like special care, holistic care that just will take care regarding your conditions and also regarding your families. The aim of this care just to like supportive care, just to cure the symptom rather than treat the condition itself.
What does
And
this mean, doctor?
yeah, just like this involved uh, pain management team. If you are suffering from any pain, you can provide you suitable pain reliever. And also, if you have any infections, we can deal with it. And also, like if you have any problem in your feeding or swallowing, also we can we can deal with it. Are you understand me, Mr. Ross?
Actually, doctor, it's shocking for me, doctor. I wasn't expected like this.
I'm sorry. I'm sorry. I know. I understand your feeling now. I know how much this news is frustrated for you.
But doctor, I think you are not treating me because I'm not donating to the hospital, doctor.
I highly appreciate your concern. Mr. Ross, not like this, Mr. Ross. Just now, this decision was taken according to your uh, cancer stage now. Are you following me?
Yes.
Till this point, are you understand me?
Yes, doctor. So
Do you
I'm
have
going
any
to die,
concern?
doctor?
Mr. Rose, I'm sorry for that. As in your conditions now, and the cancer is spreading out, and at the same time, it's not curable. I'm sorry to tell you that it can short your life.
So how much remaining for me?
What?
How much remaining for me, doctor? How
Yeah,
much time remaining for me?
yeah, Mr. John, I'm sorry. It can short your life. It might be like months and weeks rather than years. Sorry to tell you that. So, may I ask you some question? If you
Okay,
are
doctor.
okay. So what you are doing for living?
I'm an accountant, doctor.
Mm-hmm. Okay. So how much your condition impact your job and usual daily activity?
Actually, doctor, the last period it was like problematic for me because I was too much sick, the problem is swallowing and the loss of weight, tiredness.
I'm sorry for that. I will try to help you regarding this, Sir Rose. May I know with whom you are living?
With my family, doctor, and I have also
Eh,
my daughter marriage, doctor, after 2 months.
mhm.
Do you think I can catch it, doctor?
Uh, your concern is valid, Mr. Rose. Regarding this, as I told you, this condition might short your life, but we are not sure exactly if you have a chance to attend this or not, because this it is advanced and it may short your life.
Okay,
So
doctor.
yeah, anyone of your family dependent with from you.
No, doctor.
Okay, so do you need any kind of help, like social or
2 minutes
any
left.
financial issue?
No, doctor.
Do you smoke?
Yes, doctor.
Okay, so we advise you to stop smoking if possible, Mr. Rose, because it may affect your health as general.
What's the benefit, doctor? I'm already dying, doctor.
I'm sorry for that. But just to keep you and to improve the quality of remaining your life,
Okay,
and to
doctor.
keep you free from another complications that might be happen for you. Do you drink
Okay.
alcohol?
No, doctor.
Okay, so do you have another concern for me?
No, thank you.
Okay, so may I ask you, before your conditions now, it come like progressive and not curable. Do you express any wishes regarding the future plan of management?
What do you mean by this, doctor?
Yeah, I mean, did you wrote any reporting document to refuse any kind of treatment
No, I
instead
did
of
not.
you are not able to do it, in which you called advance directive?
No, I did
Did
not.
did you nominate anyone to take any decision instead of behave, in which you called the last power of attorney?
No, doctor, I did not.
Okay, so Mr. Rose, I think this is a suitable time to think regarding this and to do it. Is that okay?
Okay, doctor, I will think about it.
Okay, so do you have any concern for me?
No, doctor.
Okay, time is up.
Okay, so I provide you. Okay. This is the contact number of our department. Please don't hesitate to ask us at any time if you have any worries or queries. And also, I will provide you with the trusted website and brochure to read more regarding your conditions now and in the advanced stage, and also to read regarding the palliative care. Is that okay?
Okay, doctor.
Okay,
Okay. So
thank
thank
you,
you.
Dr. Thank you, Dr. Sarah. Dr. Alaa will comment, then I will comment.
Okay, Dr. Sarah, it's well done. The thing that he firstly, I think it's better like to ask him if he want to anyone to attend the meeting to support him. Okay, this is in the beginning. The Breaking Bad news, you did it well. You should have also asked him if he want you to explain more about his condition or about his cancer. Okay, he will say to you, no, he knows already about the cancer, but you can also offer him to explain about his disease. Okay. Then you were empathetic, and also you did for him also sympathy. Regarding the point of palliative care, you should have firstly mentioned about the plan that we are offering you, a management plan which is called palliative care. Because firstly, you told that we will bring a group of specialists, and I think you didn't mention firstly who are the specialists, then you mentioned later the palliative care. So I think should be more organized. I think the case was like more stressful for you because it's emotional. So it's better to mention that the plan of management, that what we are calling the palliative care. Have you ever heard about it? Then you explain the palliative care in detail, including also the SALT team because he has dysphagia. The other thing, the smoking. This is internal patient, like for palliative care management. It's better not to advise about smoking cessation. And also, I give you time at the end to talk about the advanced care plan, and you talked about it, and it was good. Thank you, Dr. Sai. Thank you.
Okay, thank you, Dr. Alaa.
Thank
Good
you.
comments. Yes. Well done, Dr. Sarah. Apart from your role in the clinic, you said I am one of the tumor clinic. Tumor itself is jargon. Okay. So how to
Yes,
avoid
I mean
or
cancer clinic. Yes,
okay,
cancer.
say cancer clinic. Okay. Tumor is the jargon. You mean that, but you mistakenly said tumor clinic. Back to the best word or best introduction ever. I am one of the doctors here. That's it. whatever the department, whatever the position, and the time. Okay? So the best way, hello, good morning. I'm Dr. X, one of the doctors here, whatever the department. If you want to say it, okay, try to use it as non-jargon way. Cancer clinic, gut clinic, nerve cable or nerve doctor, or whatever you want, heart doctor, but don't say it in a jargon way. So to avoid, just say one of the doctors here. The introduction is well to be or better to be with inviting someone to support him. This guy coming as promising cancer. He will be for amenable surgery or cure. But now the diagnosis changed. So he needs someone to support him. He will get out from this meeting depressed and frustrating. And he has a lot of shocking news today that no amenable cancer and there is metastasis everywhere, the liver and the abdomen wall and so on. So the best way is to invite someone, as Dr. Ala mentioned, the knowledge about his condition you should ask, and its expectation as well. Okay. So after that, you can start to do your task. The task here is, of course, breaking bad news at the first, then the palliative as a second. If you do both, you will gain good mark. But again, as Dr. Ala said, no need for smoking or alcohol advice. Why? Because this patient is at the end of his cancer. It's metastasized, and he will enjoy the last moment or last days or whatever of his life. So no need to advise him. The breaking bad news, you did it very well regarding the golden silence, the warning shots, and explaining the cancer itself spreading everywhere to the liver, to the abdominal wall. And I'm so sorry to tell you that the result now, the cancer now is not curable one, cannot be removed by any surgery or by any way like chemotherapy or radiotherapy. Why, doctor? You told me earlier there was cure. I'm so sorry. When we reviewed, no mistake here, okay? Because it was read by another doctor and initially was reported as amenable, but now the CT revised and showed that there is no cure because it's spread everywhere. Okay. Then I wrote the concern down. Yes, for how long I would lie or I would live. Unfortunately, sadly, the cancer itself shortened the patient life. And in your condition with metastatic liver cancer, no one can expect. However, as mentioned, no one can expect for how long you can live. Doctor, I have wedding for my daughter. I'm so sorry for your suffering. Or sorry, I appreciate your worry, and I know it's a difficult moment to pass all through. And having this event, I know you should be there supporting your daughter. However, no one can know what will expect, what will happen, or no one can expect what will happen. You might survive till that time or no. However, don't worry, we will not leave you alone in this journey. We will support you. And now the time for palliative, as I said. The palliative, as Dr. I believe you have to do it in this way, Dr. Dr. Ala said. You start by saying will be followed by what's called palliative team. Have you ever heard about it? What you mean, doctor, by palliative therapy or palliative team? Uh, yes, it's one of the teams assigned to have follow up with you in the case of you have a cancer, and this cancer will be not for surgery or not for cure. These doctor will keep you pain free, infection free, depression free, or your mood will be stabilized by mood doctor, the Macmillan nurse, and social worker if you need any support. This is regarding the palliative. The smoking again and alcohol, no need to ask here. The last concern, yes. If you want to ask someone he was already expected that he will be cured from a cancer, he's not expecting to die soon. So why you ask about advanced directive that he decided earlier? He doesn't expect. So the best way, as I mentioned earlier, ask him what he will prefer about his plan in the future. And please, if you don't think, please try to think about your life things. If you want to nominate someone to take care of you or to have a decision on behalf of you, or you prefer to be managed by somewhere or by different plan, or not to be admitted earlier to the hospital again, and like this. By this sentence, you did the advanced directive because no one will expect that. And at the same time, you advise him to think about his future management plan. Okay. Rather than asking him if he has decided for that, because he will never decide for that because he didn't expect this happen. Is it clear, Dr. Sarah?
Yes, clear.
Oh, okay. Any concern or question or comment regarding palliative? This is straightforward scenario. If you will be lucky if you have this scenario. Straightforward for palliative and breaking bad news. Okay, instead of smoking and alcohol, you can offer him the leaflet, brochures, contact number. The team will be beside him. We will give you multiple visits. If you want to be followed at home, we can send you at someone to follow you at home, plus the appointment. Okay, this is the way how to address the future plan without asking about something he like, because he gonna die after how many days, no one knows. Yes, the concern of how many days remains for me, no one expects. It's shorten your life exactly, doctor, can you give me days or matter of weeks? You can tell him it's a matter of weeks, maybe up to months, no one knows. Okay, don't give him exact timing or saying it's matter of 1 month or 2 weeks, because you don't know what will happen. He might live longer than other patients. Okay, but be sure that we will not leave you alone. We will follow up you. Will provide you the best care you deserve in these remaining days of your life. Clear? Okay. You have any question, Dr. Ala, Dr. Sarah?
No.
Okay, let's move to the scenario. Then I will read the comment. Dr. Ala, your scenario, I will read it now. You are the doctor in the cardiology clinic. Mr. Ahmed, 40 years old. Mr. Ahmed was doing well, but for the past 3 months, he's having bradycardia. He's not feeling well. He has a complaint of fatigue. He is known case of hypertension as well. Cardiologist assessed his condition and diagnosis of abnormal heart rhythm is made. Cardiologist has decided to insert a pacemaker for him. Talk to Mr. Ahmed, tell him about the diagnosis and about the pacemaker insertion and another, or address his concern and address his concern. Okay. Sorry. Okay. The comment quickly, and anyone has any comment, he can stop me at any time. Feel free to comment. I will try to read the comment quickly. Okay. Don't advise. Yes, I agree. Don't advise regarding stop smoking or decrease alcohol intake. Don't stop him from smoking. Exactly. Dr. Sarah, patient on palliative pathway. Why asking about advanced? Yes, this advanced directive for treatment. Exactly. So don't ask about what he decided for. You can ask about what he will decide for. Okay. So let him think about his future plan and give him hint that yeah, he should put a plan even for his for will for his family. Okay, he can write a will for his family, and he can express his wishing and he can nominate someone to take a decision on behalf of him if he lost the awareness or the power to decide, and so on. So it's a matter of future plan, not as a previous or past plan. Maybe to think about advanced yes, exactly, for finance, exactly. Need to offer psychological support. We mentioned the mood doctor along with the palliative team. No one knows what will happen from now to that time, but during this time, we make sure that you have support from our palliative team to make sure you have symptoms are under control, or as much as we can, symptoms free. However, it couldn't be controlled totally, but we will try our best. So always try to reassure however you cannot do it, but just support him and be next to him in the coming days. Okay? Anyone want to comment? Again, it's free to mention or feel free to comment, to ask. You will gain a lot of confidence. Anyone has doubt? Anyone want to suggest? Even if you want to repeat a comment, it's okay, just to gain some confidence. Okay, whenever Dr. Ala ready, we will start.
Yes, Dr. Bassam, I'm ready.
Okay, let us start.
Here you go.
Hello, I'm Dr. Mitwalli. I'm the doctor in the heart clinic today. Let me confirm you are Mr. Ahmed, 40 years old.
Yeah, yes, doctor.
Mr. Ahmed, we are here to discuss about your health condition. Is that okay with you?
Okay, doctor.
Okay. Before I proceed further, can I ask you how much do you know about your condition?
Yes, doctor. Actually, before 3 months, doctor, I didn't feel well, and also I have tiredness. And yeah, and the GP doctor check me that I have like slow in my heart rate. So I came here, doctor. Please tell me what I have, doctor.
I'm sorry for this, Mr. Ahmed. Actually, Mr. Ahmed, as you mentioned, you have been suffering from this tiredness and slowing of your heart, and we did for you heart tracing and we did for you tests, and we discovered that you have abnormalities in your heart beating. Okay, that the beating in your heart is not coming properly. That's why it's causing the tiredness that you have and also the slowing of the heartbeats. Are you following me?
Mm-hmm. Yes, doctor.
So in such
So is it
condition,
serious, doctor?
actually, Mr. Ahmed, it can be serious if not treated properly. Okay.
Mm-hmm.
Our consultant and the medical team has advised for you what we are calling a pacemaker device. Have you ever heard about it?
No, doctor.
Can I explain to you more about it?
Yes, please.
So this pacemaker is a device which gives small electric pulses to your heart, okay, to help it beat normally. Okay, it's a
Mm-hmm.
procedure. Okay, Mr. Ahmed, it's a procedure. To do it, we need to admit you to the hospital. Okay, then we will do for you some blood tests, okay, to check if the bleeding test for you is okay. Then we will take you to the operating room to put this pacemaker device. Are you following me?
Yes, doctor. Just it look like a serious or more dangerous this procedure, doctor.
Yeah, I can understand your worries, Mr. Ahmed. As you mentioned, yeah, it's like the condition may be serious, but this procedure, it's not that serious procedure, and it will be in the best interest for your condition. Okay.
So how it can help me, doctor?
I appreciate your concern, Mr. Ahmed. As I have mentioned to you, this is a device which it can give pulses to the heart. This device will be connected through some wires to your heart chambers, okay, to give some pulses to the heart to make it beat in a normal way. Okay, so it will improve. It will improve the slowness of your heart, and also after that you will feel better regarding your symptoms. Does it make sense?
Okay, doctor, yeah.
So as I have mentioned to you during this procedure, we have to admit you to the hospital. We'll do some blood tests for you. Then we will take you to the operating room. So this procedure will be done by one of our experts who did this hundreds of times before. He will pass the wire through one of blood channels, large blood channel in front of your chest. Okay, until it reaches to the heart. Okay, and this procedure will be done under imaging, that everything will be seen on a screen. Okay, then after this, the wires will reach to your heart. Okay, then it will be fixed there, and then it will be connected to a device. This device will be put under your skin, under your collarbone. Okay.
Okay.
Okay. This device, it's what we are calling the pulse generator. Okay. This is a device which is generating the pulse to your heart to make it beat in a normal way. Are you following me?
Yes, doctor. Yes.
Okay, so as any procedure that we are doing, it has its benefits and it has also its risk. Okay, so the benefits of such procedure, it will make your heart beat in a regular way. It will improve your symptoms, and also it will help sinister things from happen. In such your condition, the condition may progress, and sometimes it can cause a major problem in your heart, and sometimes also it can result in stopping of the heart beating. Are you following me?
Yes.
So this device will help to improve such symptoms. But bad effects or the risks that can be associated with such a device, that during insertion there can be bleeding, there can be injury to nearby structures. There is also some risk of infection. But make sure that we will do our best to prevent such bad effects. Okay, we will clean the area good. We'll check your blood test, bleeding test to prevent this bleeding. And as I mentioned, you will do the procedure under full imaging to prevent any injury to any nearby structures. Are you following me?
Yes, doctor.
Do you have any concerns till now?
Yes, doctor. It looked like painful, doctor, this procedure.
I appreciate your concern. Actually, Mr. Ahmed, during the procedure, we will give you some medications to numb the area through which the doctor will do the procedure. So it will decrease the pain, and also it can help you to not feel any pain. That okay?
Okay, doctor.
Okay. So as I mentioned to you, it will be connected to a device. This device has a battery. You need to do regular follow-up with us, okay, to check the battery life. And also you need to have some precautions after doing such procedure. Okay. You need to avoid vigorous exercises. You need to avoid contact sports. And also this device can be affected by magnet. So you need to avoid being near to strong magnets. Is that okay? We will give you also what we are calling Pacemaker ID card. Okay, this card will be remain with you because with this device, it can be difficult for you to pass through check gates. But with this card, it will help you to pass through check gates like in the airports. Is that okay with you?
Okay. Okay, doctor.
Okay, and also sometimes during doing imagings, it can also this device can have a problem with the imaging, so they can check if this at that time they can check if the imaging can be done or not. Is that okay?
Okay.
Do you have any concerns till
doctor.
now?
No, doctor.
1 minute
So
left.
as I have mentioned to you, this procedure is in the best interest of your condition. If you agree to do such procedure, you need to sign a consent in which the full information that I have mentioned to you about the procedures, about the benefits, about the risk, everything will be mentioned in the consent. Okay, then you will sign it, and you have the right anytime to withdraw from this consent. Is that okay?
Okay, doctor.
Okay, Mr. Ahmed, I will give you
Everything.
also some brochures and some websites to read more about this device and to know everything about the procedure and the precautions that you should take. And if you have any queries, I will give you also our contact number to contact us anytime.
Okay, thank you, doctor.
Thank you. Do you have another concern?
No, thank you.
Okay, thank you.
Okay, well done, Dr. Ala. I draw for you because
so
I want to remind you how to do and how to draw, and you should draw. Okay,
Yes.
you can
This is
draw by
my
yourself. By the
comment,
way.
yeah.
You can draw it in the screen by yourself. It's accessible to everyone. Okay, your comment, Dr. Sarah, then I will comment.
Yes, mashallah, he did very well. Just regarding the drawing, if you are drawing, it will be better. Yes, in any procedure, before, during, after, as we did. Okay, just the advice you give, some lifestyle modifications, yes, avoid the magnetic field like MRI, and also avoid any trauma, strenuous exercise, okay, contact sport, just safety netting advice. Okay, it's most important. At any time, if you are feel any abnormal beating or dizziness, or you feel more fatigue or tiredness, please come urgently and to seek medical advice for that. Okay. And also regarding the complications of this procedure, apart from the general complications like pain, injury, infections, so there is another specific complications like this wire sometimes can be displaced. Okay. You did regarding the battery device, regarding the battery, it should be monitored and it might need to be changed, and the card, it is important and you are mentioning it. Okay. So I think you did well. Yeah.
Okay, thank you, Dr.
Thank you.
Sarah.
Thank
Thank
you.
you. Well done, Dr. Ala. Again, the drawing is very important. You have the paper, you have a pencil. Just draw even simple drawing and show the examiner that you are trying to explain him in simple way. It's not a professional drawing. Just imagine and simulate the body, the battery or the device, and the wire, and how it goes to the heart. That's it. It's not a big matter. You can do it by yourself. Anyone can do it. It's not need to be a drawer or someone is professional. Just to simulate. From the beginning, the introduction was perfect. You are the doctor in the heart clinic, so you avoid the jargon. And this way, the The question in the front, in the beginning, either here or the previous scenario. How are you now? How are you today? How do you feel? I forgot to mention, but here you can say it or you can ask him. How do you feel now? How do you feel today? Uh, are you okay? Any questions that you can just calm him down. Then the question of the introduction, what do you know about your condition, and the expectation. Then the task straight away. We are here to discuss a procedure for you. Have you ever heard about the pacemaker, or it's called pacemaker? Have you ever heard about it? It's a device or battery will be blunted implanted under your skin and connected through a wire to your heart. And this wire will be inserted in your heart room. Okay. Why? Or what the indication? In your condition, because you are having change of your heartbeats, electricity, this machine or this device will help you to overcome this problem. This is the indication. And how it will be done, I will show you in this figure. Then start to draw and always focus on the before and during and after. Before starting or doing the procedure, you have to be admitted, as you said exactly, to the hospital. You can say in a daycare or a daycare unit or the heart unit or whatever, but you will be admitted. We will check up all your blood test and work up to in order to have a good and safe surgery or safe procedure regarding your bleeding or any other abnormality in your blood, and also to have a consent form before the surgery or before this procedure. This is before. During, we will transfer you to the unit assigned for this procedure or the procedure unit or 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 operating. But I think it's not operating room, but according to the hospital, it might be operating room, but better to say procedure room. Sometimes they are doing it away from the operating room, fluoroscopy or a unit related to the cath, whatever. The patient will be transferred there and will be sure that the pain management team will be there. This is the most concerned complication ever. The pain. I am worried about the pain, doctor. So the pain management team will be there to provide you a painkiller properly and appropriately, either by numbing the area or giving you some medication through the blood channel to be sure that you are not feeling any pain. Try to focus on this point. Of course, in between, you have to ask, are you following me? Do you have any concern? I prefer Dr. Sarah to say, are you following me? Better than saying, do you understand me? Okay. Because it sounds that he didn't understand and he has some mental issue. So the best way is, are you following me? You have any concerns up till now? No. Continue. Okay. Don't ask, do you understand me? I forget to comment about that. About that in the first scenario. Back to the during. So the anesthesia or the painkiller, then you will be lying comfortably on the bed, and the doctor who will do the procedure will attend. And he is expert one. He did it many times. Don't count as hundreds because you don't know. Maybe it's not 100. Maybe he will tell you why you will judge as 100. So many times, and he's professional in it. He will have a small cut incision in your chest skin in front of your chest, and the battery will be implanted there, connected to a wire. This wire will end up in the room of the heart, and through the electricity, it will give impulse, or it will be a pushing impulse to provide you a normal and regular heartbeat. Then the post surgery or post procedure, you will be admitted for 24 hours for care and monitoring to be sure that you don't have any bleeding, you don't have any pain, your blood pressure and everything in your body is okay. And later on, if you are fine, we can send you home, or we can ask someone to drive you home if you don't have anyone. Okay. The complicate, he will tell you, doctor, it seems serious. Yes, every procedure had a benefit and had its risk. One of the risk here, you have to mention to him, you might have bleeding, and we'll be sure that regarding the bleeding by doing the blood test, regarding the pain, we will bring, or we will call the pain management team or the pain doctor. Might either it will injure to, or it can lead to injury of nearby organ. However, we will use a screen as you did, which is perfect. Screen, we can see the wire while it's going all through the procedure. And the infection, we will try to make the area of the skin clean before starting and during the procedure. These are the most important for procedure, sorry, for complication for any procedure. 2I, 2Ps. Remember them always, because you have to mention them as a common complication. Back to the safety netting. Finish the procedure, so you can ask someone to drive you home, or you need someone from here to drive you, or someone will take you. You cannot be, or you are not able to drive while you are going back. Definitely, he will not drive. This is another issue you should address. If you are driving, please stop driving for 1 to 2 weeks until we will be sure that everything is okay. Okay? Because you didn't mention, I think, driving. Right, Dr.
No,
Ala?
no, I didn't mention it. I wrote it down
Okay.
here in paper, but I forgot to mention it.
Yeah, that's why. Okay, try to remember the most important things. Okay, back to the safety netting. You mentioned good things, by the way, the airport, the lifting the heavy object, vigorous exercise, contact sports, all these things, it's okay to mention. As Dr. Sarah also said, sometimes this lead or this wire could be broken and the effect will be decreased or even aborted. The also machine like MRI, like a magnetic field, or any, as you said, the checkpoint and the gates in the airport. All the things, yes, it's good to mention, but driving is very important one to mention. Okay, because it's for, at least for 1 week, to be banned from driving until we'll be fine and everything is okay. The social and the job is very important here. Smoking and alcohol, if you have time, yes, you have
The
to do.
driving also the surviving, yeah.
Sorry, sorry, Dr. Sarah, what you said?
Yeah, driving, yeah.
Yeah, with I just talked about it. Okay, is it clear for all? Again, the procedure, one of the easy scenarios, if you know the 3 steps during, before and during and after, just follow the steps like a story, and it will be easy. And you can just draw for him, mentioning the most for important complication, and reassure him always, because it will be done by expert team, and it will be monitored after the surgery or after the procedure, and the support, driving, the job, according to the scenario. Okay. Again, it's a lucky scenario, as we have today, the palliative and the procedure. Both of them are lucky one. Any question, Dr. Sarah, Dr. Ala?
Yeah, which are unlucky scenarios, Dr. Basim?
Unlucky scenarios, if you have, for example, uh, a scenario which you didn't practice before. This is the first bad luck. If you have a
Yeah.
scenario for from the first time in your life, and you don't understand what they want from you, like negotiate with the patient. You will try to argue with him, and he will ask you to do something, and you cannot understand him what he wants, and you are talking about something he's not understanding what you want from him and what he wants from you. This is the unlucky, means that uncertainty. For example, you don't know what the point is in the scenario, but the clear scenario like palliative therapy, like procedure, it's clear. Medical error, it's clear. But the uncertain one, you don't know what they are talking about, what they hide in the scenario, what you should talk about. Okay.
Yeah.
Sometimes also you have medication for the first time in your life as a practice
Mm,
again, or a disease which you didn't do it before. The clear task always will be easy, hopefully, because you know the cornerstone of every scenario. In our today scenarios, the palliative, you know how to talk about the palliative and breaking bad news. For the procedure, you have to talk about the steps of the procedure, the complication, the indication, safety netting, the precautions. That's it. Okay.
yeah, that's right. Yeah.
Don't worry. Hopefully, you did a lot of scenarios, and hopefully, the scenario will come to you. You did it before. Just follow the instructions and the advices, the sympathetic and empathetic way. Try to act with the patient or the surrogate. Let him talk. Try to understand him. Try to listen to him. Even if you are not understanding the scenario, you can understand the point from the scenario during the discussion. And the task, focus on the word or the sentence after the task. What is your task? Clearly, try to do it. Okay? Any question, Dr. Ala else?
Yes, Dr. Basim, the suicide scenarios are coming in our area nowadays, or
Even
they
if it comes, don't feel panic whenever you see it.
yeah.
Okay, yes, it comes. And be ready. Don't say it will not come. No, you have to be ready for any scenario. That's why the practice is very important. Do the suicidal attempt in another day, even in our session or with any mentor or as you want with a partner. If you want to do communication, you have still 2 days of communication this week. You want to do suicidal, ask the partner to prepare for you a suicidal attempt scenario, and let's do it. If you want to revise the suicide attempt scenarios that we have been
Mm,
practice, we have a lot of suicidal attempt scenarios in the group.
yeah.
But don't feel panic at all. It's easy. You have to address to know the circumstances of the suicidal attempt to decide if it was intentionally or unintentionally. If intentionally, never ever let the patient leave. If intentionally suicide attempt happen, don't let the patient leave for any reason. You have to review or to revise or to refer him to the mental health team to assess his capacity. Because whenever you let him leave or he asks you, I want to leave, and you let him leave, you will fail the station. Why? Because this patient might go back home and he will attempt another suicide and he will be successfully die the next time. So there is some hidden points you have to avoid, and the remaining of the scenario will be easy. Just address these circumstances, and you can judge by yourself. Is it intentionally suicide, or it was just unintentional, or by mistake the medication received? And according to the scenario, according to the circumstances, you will decide to admit and to even detain the patient in the hospital. Okay, clear, Dr. Ala?
Yes, Dr. Basim, it's clear.
Okay. You are doing fine in the whole stations. Don't worry.
Thank you.
Yeah, you are on the good track and the right track. Hopefully, inshallah, you will do it. Any comment or question, Dr. Ala and Dr. Sarah?
Thank you, Dr.
Anyone?
Basim.
Most welcome. Anyone want to comment or to add any comment? Okay, I will read the comments quickly. In suicidal scenario sent to which team? Yes, it's called Mental Health Act team. The team assigned to address the patient capacity if he or she is able to be discharged or no. And it will be referred within 72 hours or as soon as possible. So during this period, if the patient insists to leave, try your best and prevent his discharge. Don't tell him, yeah, it's your right to be discharged. No. If you let him discharge, or you did the discharge decide or decision, or the discharge summary, or you accepted his discharge, you will be in trouble, particularly if he has a success or high success of the suicide attempt. Okay, so he should be referred to the mental health team. The other comment, safety netting again, please. For which scenario? For the procedure? The driving is the first safety netting. The driving. He cannot be drive. If he is taxi driver or he is type 2 driver, the duration will be longer, 6 weeks. For his own car, it will be 1 week only. The driving, heavy object, lifting heavy object, doing vigorous exercise, sports, MRI, magnetic field room, or the checkpoints in the gates, the card you can offer him. Okay? All this is important or are important. Okay. Yes, the consent I mentioned, and that's why I mentioned the comment earlier, because it's possible to forget it. The consent form is very important. It's one of the maybe the cornerstone of the scenario. If you didn't offer the consent, you might fail the clinical judgment or the clinical communication. So offer it earlier, and at the end you can tell him, "I will hand you the consent form. It contain everything in details about the procedure, and whenever you are agree, just sign the form and be ready, or it's your right to withdraw at any time." Yes, he mentioned it, by the way, Dr. Ala. Driving, social, yes. Serious procedure. Yeah, this is my the concern of the scenario. It looks serious procedure. How it can be done as withdraw. It seemed to be painful. Yes, there is pain with every procedure. There is possibility of pain. However, we'll try our best to give you the pain management appropriately. Okay. New comment. Job of the patient is important. Yes, we mentioned Dr. Sahla. He should ask about his job. And according to the job, you might have a concern. So, for example, if he's a coach or gym coach, or he is a player, football player, or a driver, taxi driver, lorry driver, it will be like two in one address, the driving and the job. So you have to give him two advice in one task. The job, he should be away from the job by sick leave, and the driving itself, he should stop driving temporary. No, sorry, yes, temporary, according to the DAVLA. Any question? Any other question? Any comment? It's clear for all? Satisfied? Sometimes I'm wondering, 30 candidate and no one is raising the hand or even talking, asking, adding comment. So it's not a matter of only writing comments. You can even verbally comment. The day of interactive session, it for me, it's much better than being talking by myself only. So please, anyone has any point to be raised, any point to be clarified, you can ask at any time. If it's clear for all, I will thank Dr. Ala and Dr. Sarah.
Thank you,
Wish
Dr.
you,
Bassem.
yeah, most welcome, Dr. Ala. Before ending the session, the last announce any question. Okay, seems no question. We'll end the session. Thank you everyone for the attendance. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you, Dr. Bassam.